to know and master the different areas and the different parts of the spinal cord itself and the surrounding or the protective tissues. Okay, so starting with the tissue, with the surrounding tissue, Kathy. Starting with the surrounding tissue, these tissue are we said are called meninges. Okay, and we have three of them. The innermost one, this one, that ensure tightly to the spinal cord itself, it's what? What is the name of this one?
Yeah.
The pia mater. And then the outermost one, which is a fibrous and strong meninges, it's called the dura mater. And the one in between, it's the arachnoid. Okay, and we talked about different spaces, okay? And we said there is a spaces in between these meninges. So the space, the outermost one filled with vessels and adipose tissue is called the epidural. And the importance, what is the importance of this space? We make like a special injection. What is it? What is called? What is the name? What we epidural. Okay, so it's epidural anesthesia.
Spinal tap is above that, right? No, it's below. Spinal tap is below because
It's not about below. It's the site of where we insert the needle. It's the same. Okay, just how far we're inserting the needle. Okay,
I thought the spinal tap goes in the arachnoid space.
The arachnoid, and the spinal tap is just to take some of the arachnoid, the cerebrospinal fluid.
Right.
It's not about
So
injecting
it's the
any
same
drug.
place on the spine though? I thought it had to be lower than the
Spinal cord.
than the spinal cord. It's
T4 is like where
Yeah,
the
where we insert, you mean where we insert the needle?
Yes.
Yeah, the needle, it has to be like below the L2, okay? And the safest place is between L4 and L5, okay? Because we have like landmarks, so we know exactly where is L4 and 5, the space L4 and L5, okay? But no, the tap is not for anesthesia, it's for to have some of the cerebrospinal fluid. And the tap is, we go to this space here where we have the cerebrospinal fluid. It's the subarachnoid space, okay? So it's not the same space. And we can inject some anesthesia here, but it's not the epidural anesthesia. It's called, it has another name, the spinal anesthesia, okay? Because we are injecting the drug inside the cerebrospinal fluid, and we are like numbing the whole spinal cord, okay? And this one is like we give just one dose, okay? If we do the spinal anesthesia, we use just one dose, okay? But for the epidural, we give like repetitive injections, okay? So, talking about the meninges, we can see the meninges and this